If you are one of the 500,000 Americans who suffer from Crohn's disease, or if you know someone who does, then this information may be helpful for you. My name is Amy, and I'm going to tell you about my personal experience with Crohn's disease and what I have discovered along the way. Crohn's disease is a disease of the digestive system characterized by inflammation of the intestinal mucosa. Crohn's disease can affect any area of the GI tract, but it most often affects a part of the small intestine called the ileum. Crohn's disease can be difficult to diagnose because its symptoms closely resemble those of other digestive disorders. These symptoms include weight loss, diarrhea, bloody stools, abdominal pain, cramping, and fever. Chronic inflammation of the GI tract, a typical result of the disease, may lead to bowel thickening, scarring, abscess, and fistula formation. Tests used to confirm the presence of Crohn's disease include a CRP or SED rate test. If these tests are high, then inflammation is present. A CBC, they will use this test to check for an increase in white blood cells. They may also look for iron deficiency. Bleeding in the intestines will result in anemia. A colonoscopy may be ordered to get a closer look inside the intestines. Traditional treatments for Crohn's disease include anti-inflammatory drugs, steroids, and immune system suppressors. These treatments are designed to inhibit the immune system response and reduce inflammation, but do not treat the underlying cause of the disease. I was diagnosed with the disease in 2001 after suffering from pain and diarrhea for months. I went to my doctor several times with complaints of poor health and eventually was sent to a GI specialist who ran several tests and gave me a diagnosis of Crohn's disease. Even after my diagnosis, my symptoms continued. The inflammation medicine prescribed did little for the condition. For 6 years, my life was completely changed by the disease. During those 6 years, I experienced extreme weight loss, getting below 100 pounds on 2 occasions. I had a bowel resection, losing 6 inches of my intestine, my appendix, and ileocecal valve. I didn't eat salads or anything with much fiber due to the pain it would cause as it moved through my GI tract. I experienced symptoms of malnutrition, arthritis and swollen joints, poor eyesight, and skin conditions. I spent my time looking for anything that would help with the disease. I read every book I could find on treating digestive disorders, spent thousands on products that promised to alleviate the symptoms, visited doctors and healers of every kind, from traditional GI specialists to energy healers. Although I was sure one of the many things I tried was going to help, nothing improved my condition for any length of time. What I found eventually started to put some key pieces together and started to improve my health. I began to figure out what things to eat, what to avoid, and how to reduce stress levels. But the most significant was the discovery of alkaline water. Most doctors will tell you that diet doesn't seem to matter when it comes to digestive disorders, but the opposite is in fact true. Diet is significant when it comes to healing your digestive tract and limiting the amount of irritation. I found that avoiding dairy products with a GI disorder is key. This may seem to be impossible to give up, and indeed it is difficult, but there are many great dairy-free items on the market today, and the result is well worth it. I use almond milk for cooking and consuming. If I'm craving ice cream, I go for the excellent flavors made from coconut milk. Experiment and find the substitutions you like best. When your digestive system is upset, you will want to opt for easy-to-digest foods. When I was at my worst, I ate a lot of pureed, dairy-free soups, steamed rice and veggies, and soft meals. It may be tempting to skip meals for protein or for protein shakes, but many of these contain whey products and are not well tolerated. If your GI tract is inflamed and irritated, you will want to avoid consuming items with a large amount of irritating fiber. Things like raw vegetables, nuts, seeds, and salads probably won't work for you at this time. Acidic foods can also be irritating to the inflamed or sensitive GI tract. Avoiding orange juice, tomato products, foods or beverages with added citric acids, onions and garlic, and caffeine may also be irritating and may need to be omitted. Cutting out these items will allow the GI tract to calm down a bit. Other highly irritating foods to the GI tract may include wheat, corn, processed foods, and our favorite, high-fat and deep-fried foods. Dr. Hiromi Shinya, a world-renowned GI specialist, says the worst lifestyle habits are smoking and alcohol, so be sure to cut those things out as well. Alkaline water, I discovered, seemed to be the missing ingredient in my search for healing digestive disorders. In any chronic disease condition, your body is extremely acidic, but for your body to maintain optimal health, the pH of the bloodstream, for example, needs to maintain about 7.365. pH stands for potential of hydrogen and is measured on a scale of 0 to 14, 0 being strongly acidic and 14 being strongly basic or alkaline. Many of the foods we consume on a daily basis are acidic in nature. They cause undue stress on the body because the body does whatever it can to maintain the appropriate pH levels. If your diet is consistently acidic, your body will rob itself of alkaline mineral stores to buffer the acids. The result is osteoporosis and a host of other health problems.